I remember as a kid when the space shuttle blew up and we were all told to hold the room and hold space and hold silence and honoring all those people that died. And so I used that same concept that I learned as a little kid and applied it into the trauma bay. We've been pausing since man was probably unable to speak. You know, death makes us stop.
Tell me about the pause, how it came about, and why you felt there was a need for this.
I was given a mandate after I left this 7-day intensive retreat to make an impact in the world I worked in. Most of the people I worked with at the time were all, at least in the retreat, were all palliative or hospice people. But I was an ER nurse, so I went back into the emergency room and saw a gap within care. It started off very selfishly. I wanted a way to honor a patient, and I didn't necessarily use the same language as the chaplains were using, because I came at it from a different perspective. Even though the intent was great, didn't capture what I wanted to need for myself. And so I implemented the practice called the pause.
You have been an ER nurse for how long?
I was an ER nurse for 11 years, shock trauma level 1.
That's an area where you see a lot of unexpected deaths.
Right.
In the ER, you really don't have time to develop a relationship with that patient.
Right.
How do you feel when you lose somebody?
Well, the difficulty in a lot of the environments we work in is that you've got to pivot and shift and move because the next patient who's sick needs to be addressed and needs to be taken care of. I would feel like I was dropping something and just leaving it and not really putting it down. The practice of the pause allowed me to actually put it down. It's no longer that body that we tried to resuscitate. It's now someone's brother, someone's sister, someone's father, and we're taking time to honor the life that was lived prior to the moment of death. And we're also taking time to honor our own selves and the efforts we put in to try to resuscitate them. It's now used in hospices. EMS providers are doing it out in the field, and it's being done in organ transplants for both the donor and for the recipient. Now, I've even done a pause in the ICU after they resuscitated someone because of the difficulty of what they went through to get the person back. Luckily, I looked around the room when they asked me, and I saw the monitor, and I saw that there was a rhythm. And so I had to, at that point, shift it and pivot and reword it in such a way to honor just the efforts to bring this.
I really love this because it recognizes the humanness of the healthcare team. Give me an example of what you would say at pause.
I would first ask permission. I'd also ask the team if it was okay to stop and take a moment to honor the life that was in front of us and do it in silence. And then I go on to say this person was alive. You know, before they came in this hospital, they were loved by someone and they loved someone else. They were someone's brother, someone's sister, someone's family member, and they lived a life. And if we could just, in our own way and in silence, hold that space and honor that person and honor the work that we've done. We'll take 30 seconds if that's okay. And then we just hold the space.
Tell me some of the reactions of the healthcare team to this and of the families. How have they responded?
The responses have been tremendous, really positive. From it made me feel better, it allowed me to put something down, and there's been some negatives, and people have said, you know what, I can't do that. We have a lot of wounded warriors in healthcare that have seen and been exposed to lots of pain, and sometimes holding space for 30 seconds is too much. And what I usually say is then we let that person honor that. Let that person not do it. Allow them to walk away. But don't let them walk away and not do anything about it. Try to figure out how we can help them further, you know, through EAP, through professional help, through support, because that pain needs to be managed and of course do it in their own time. I was amazed that families felt the way they did, because again, I selfishly started this practice for me. And then the side effects of police, security, secretaries that are around in the emergency room or in the ICUs, they all hold that space. I'll give you an example. In Charlottesville, we had some turmoil August 12th of last year, and a young woman was killed, and I would say by a terrorist attack. She was run over by a car. She was brought in the ER, and she was pronounced. But everyone in that ER at UVA stopped and held a moment of silence for her after they pronounced her. And that made a difference for them, you know? And whatever difference that is, it's individual for each person, but it's so important.
Self-care is what nurses fail to do a lot of, and they get burned out. They get compassion fatigue.
Well, and how do you offer compassion to another human and you don't offer it to your own self? It's like feeding your baby, but you don't eat. You know, you starve yourself, and you starve yourself with compassion too. And I think the languaging is very important. The languaging I use is universal. If we become religiocentric with our language with the pause, we can cause spiritual harm to the family, to the patient. And so I caution in that as well. That's another slippery slope.
Exactly.
You know, your God may not be their God. Your belief might not be their belief. But if you hold that space in silence, you're allowing everyone to share, even if they have no belief at all, in that moment.
Now, I know that this has spread. What tips can you give for people who want to implement this?
Cleveland Clinic just adopted it for their whole system, all the way down the East Coast, and I gave them some instructions on how to do it. Obviously avoiding the protocoling and offering the invitation, finding leaders in your units that believe in this and will help spread it, and also realizing it doesn't have to only be a nurse that calls this. It can be a tech, it can be a physician, it can be anyone in that room. It spread through my University of Virginia without any protocol whatsoever. It spread because people saw it and then they replicated it across the institution. Other places make it more formal and they write things up and give instructions and give guidance. But my website is thepause.me, and I invite people to go to that. There's a video on there. I'm hopefully going to produce another video based on my winnings from this too. It's a self-funded website that I use to help spread this message across the country and across the world.
Congratulations. So I think the word has gotten out even more.